Hello, Canterbury residents. I am Dave Hone, your Executive Director. Welcome to our Town Hall meeting for July 2020. First, we will have Director Video Reports, followed by our Resident Council President, Betty Daisy, who will update residents on a few pertinent matters. First, let's hear from our directors who will introduce themselves.
Good afternoon, ladies and gentlemen. My name is Daniel Corrales. I'm the Human Resources Director here at the Canterbury. I wanted to talk about the employees we've hired since our last meeting we had in person back in February. Since then to now, we've hired 18 new employees. 2 of them are LVNs and 10 of them are care partners for our assisted living department. 3 of them are dishwashers and 1 server for our dining services department. We've hired 1 night security. We also hired 1 housekeeper in our environmental services department. I also wanted to take this opportunity to thank our employees regarding our service awards. We've had 11 employees receive service awards for being here for 3 years, 5 years, and 1 employee for being here for 15 years. So I'm going to read out their names. So these are the employees that received 3 years of service. Carmen Leal, she's our housekeeper. Rosabel Barrera, she's also a housekeeper. Celeste, she's our chaplain. Edgar, but goes by Eddie Avila, he's our dining room supervisor. Leonel Castañeda, he's one of our servers in our main dining room department. Pituela Iona, but goes by Pita, she's our server in our Catalina experience. And Rodolfo goes by Rudy, he's one of our cooks. Now I want to acknowledge the employees that received 5 years of service. Florence Rabosa, she's a care partner in our assisted living department. Josephine Salazar, she's our care partner supervisor for Artful Home Care. And Manuel Delgado, he goes by Manny, he's one of our cooks in our dining services department. I also want to give a special thank you and acknowledgement to one of our employees that received her 15 years of service. Her name's Anna Sandoval, and she's our LVN in our assisted living department and independent living department. I also want to take this time to say I miss seeing everyone in the hallways and staff events and resident events when we had events on the patio, the Valmonte room. I really miss seeing everyone. But I also want to take this time to say, stay strong. We're doing this together and we're gonna be together soon. I just want to say thank you for your time. And when I do see you, I'll make sure to stop by and have a conversation. Have a great day, everyone.
Hello. And I am Chaplain Celeste Stump, chaplain at the Canterbury. And I am thankful for this opportunity to say just a word or two for our town hall meeting. First of all, please remember and be aware that we are giving so much to others and ourselves when we wear our masks. We wear them because we care. Secondly, let's remember social distancing. This is just a reminder. Because when we socially distance, although it may not feel like it, again, we're showing one another we care very much and want all to be well. And lastly, I am working very hard on our interfaith prayers, which you have read, I hope, or listen to on channel 1960 at 11 o'clock, and that occurs on Sunday. And I hope you've enjoyed my Chaplain's Corner that I began. Just giving a little thought to a piece of history of our day, or a thought to others and those that we have known and do know. So I leave you with this also, that I am working very hard to prepare to start having some worship services. I don't know what it will look like exactly. I do not know when I will be able to begin this exactly, but you are all in my heart and I care very much. And through this difficult time, please remember, none of us are alone. Make a note to one another, write a letter, give a call. And I thank you, and I'm always, as always, grateful to be here at the Canterbury. Take care.
Hi everyone, my name is Renato. I'm the Director of Dining here at the Canterbury, and just wanted to give you a quick summary of what has been happening in our department. I want to reassure you, first of all, that we have been working very hard to make sure that we can keep our community and our residents safe. Glove wear and hand washing during our preparation process has always been a standard. Now our department all wear masks. We have multiple hand sanitizing stations. We have added a couple of cycles of sanitation throughout the day, as well as disinfection of common areas at the end of the day. We've also worked hard to shore up our supply chain so that we are always going to have the quality and type of food that everybody is accustomed to. We have not had any issues with finding the items that we need so far, thanks to the relationships that we have with our vendors. Also, I wanted to let you know that we have a great team of people in our department that really work very hard every single evening to make sure that we can provide you with the best dinners that we can, minimizing the amount of time between your meal being plated and it being delivered to your apartment. I think we've developed a very good system, and there's only a few minutes of time elapsed in between those areas. Then I also wanted to remind everybody about our pantry. We have a pantry list that is out there for you to purchase items so that you don't have to go to the store if you don't need to. We stock all those items in our kitchen, and we are happy to fill those orders and deliver those to you whenever you need them. We've also added this service to staff members here at the community, because by minimizing the exposure of our staff, then that adds to the safety of our residents. Lastly, I just want to say that we miss seeing everybody in the dining room and Catalina in the special events, but I know that we will be getting back to that at some point. What it may look like with social distancing and masks, we are developing a plan and making sure that we have all our plans in place prior to launching a new dining room experience, but it is something that we are working on. If you have any questions or comments for me, I always appreciate hearing from everyone. Your comments help us to improve, and the members of our department always enjoy hearing any feedback from you. So my extension is 5132. If you ever need anything, please call me. If I'm not here, you can leave me a message, and I will get back to you as soon as I can. Thank you very much, and have a wonderful day. Bye-bye.
Who is it?
It's Bella, delivery.
Oh, dinner time.
Oh boy,
Hi.
I had a big lunch today.
Now you got more food.
Now I got more food. Thank you, Bill.
You're
I
welcome.
appreciate everything you do.
Thank you.
You're
See ya.
welcome. Oh boy. Oh boy, this looks really good. What do I have today? Oh, I have a nice cannoli. See, that's got cream and butter and stuff in it. Okay. Ooh, and I have a nice little appetizer on some flatbread. And guess what? That's got cheese on it. Okay, well that's good to know. Why is that good to know? Because I'm gonna need to refrigerate this if I don't eat it right away. But now the coup de grace. Ooh, what do I have here? Yummy, yummy, yummy. I have some broccoli, which is good, which is safe. I've got a cabbage roll that has meat in it and a nice sauce on it. And I have corn pudding. Well, I'm sure that's got eggs in it and cream. But you know, I'm not really hungry right now because I just had a big lunch. So I think I'm going to save this. Oh, what does this say? See, I have this little sticker on here that has the day it was prepared and how good it's good for. So this says 7/20/2020 to 7/23/2020. And it's warm. Might want to let it cool down a little bit. And then I'm going to refrigerate it. I'm also going to refrigerate the cannoli and my flatbread because it both has cheese on it. Now I want to make sure my refrigerator is at the correct temperature. Now what's a good temperature for a refrigerator? Well, the USDA suggests 40 degrees and below. That's the standard that we follow in my kitchen. Every refrigerator has to be at least 40 degrees or below. And we check it twice a day just to make sure, because we don't want to have any problems. So I'm going to put both of these, because these are already a little chilled, they're not hot. I'm going to continue to let this cool down a little bit. And it's really, really important that I always, whenever I get something like that, like especially dessert or fruit, or even a salad, because it has salad dressing in it, I want to make sure I put that in the refrigerator immediately. Now, naturally, if you get mud pie, where's that going to go? The freezer. And by the way, your freezer should always be a minimum of 10 degrees, if not colder. I mean your freezer. What else? So now we talked about our tag. So when this reaches July 23rd, 2020, which is 3 days after this, and I haven't eaten it, guess what's going to happen? Down the chute. It's going in the trash. Because I'd rather not eat it than take the chance of eating it later and getting ill. And that'll ruin my whole day. And no one likes to get sick in the tummy. So, let's say tomorrow I decide to have this for lunch. How am I going to do this? Well, these containers are microwavable safe. So I can put this in the microwave probably for about a minute. Take it out, check the temperature, rotate it, and put it back in. Now, since this had a sauce on it and broccoli and the corn pudding both have a lot of moisture in it, I'm just going to do it like that. But let's say I had something like a chicken breast in there, or a casserole, like lasagna, okay? What I would do is, I would put a little bit of water in there, just a little bit, maybe a teaspoon, just to create some steam. In fact, that might be good on my broccoli, just to create some steam in the microwave. Otherwise, it could come out tough and dry, and we don't want that. Another trick that I do is, I would take this and I would put it in like a little casserole dish with the lid. It just seems to heat a lot better in China than in one of these. But these are fine. At least you use this, you don't have to wash the dish, right? Exactly. So that's really about it for now. Oh, one more thing I wanted to bring up. I used to take care of my parents, and I would go over their house weekly, but once a month I made it a point to pull everything out of the refrigerator, get some soap and water, and clean the refrigerator out. I would also look in their freezer to see if there was anything with any freezer burn on it, those little icicles that gets in the freezer. That's not good to eat, especially with ice cream. So I'd go through and I'd look at that stuff, and then I look in the refrigerator, see if there's any biology experiments in there gone bad. And sure enough, there were things growing in there. Out the door, I'd throw those out as well. And then I would just go ahead and clean it, dry it up. I would first take all my food and put it in an ice chest, and I pull it out of the ice chest, put it in the refrigerator, and then close the door. And I would suggest doing that for everyone, once a month. It's not too bad. And you make sure everything's nice and clean. Plus, if there's anything hiding in there, you find out really quick. Some old fish. Speaking of fish and raw meats, always be sure to put any raw meats on the bottom of the refrigerator. Accidents happen. You don't want any meat juices or any fish stuff falling on your salad. No. So always put raw food on the bottom. Make sure it's covered, preferably in a Ziploc bag, and nice and chilled. Put all your ready-to-eat food above it. Now I know all of us in our refrigerators, we have a little produce drawer on the bottom. Okay, as long as that's shut fine, and if you have any raw meat, including bacon, especially bacon, make sure it's in a Ziploc bag, or at least in a container that's covered and sealed. Well, that's it for now. I hope I covered everything. If you have any questions, let me know. Thank you very much.
Hi, it's Robin Gordon from Environmental Services. Just wanted to update you a little bit on what's been going on in my areas of responsibility. The one thing you've probably all noticed is that the housekeeper's back every week, so we're really pleased with that. We did have to make quite a few changes to the length of time that the housekeeper is there, the area different people are assigned to, and I apologize if this has been a little disruptive, but really the new structure is much more ideal for making sure that we're following the best practices for infection control. We're assigning a specific person to a specific area. We're not carrying things between buildings where we don't have to, and I think in the long run it'll be a much healthier structure than we had before. So if you have any questions about that, just reach out to me. I will be coming around starting in August and just doing some quality inspections on the housekeeping work that's being done in the resident apartments. So I look forward to seeing quite a few people that I haven't seen in ages. And of course, I'll only see you from the nose up because I'll have my mask on and you'll wear yours, but we'll maintain our distance, but we'll still have a chance to visit. So please, at those visits or anytime really, if you have feedback about the housekeeping service that you're receiving, compliments or concerns, we're happy to hear it all. So I look forward to seeing many of you very soon. Maintenance, if you're in need of repair work or anything, or some kind of assistance for maintenance in your apartment, the process is still the same. Get in touch with me or the front desk and place a work order, and we can come and help you out with the things that you need. So they're still here to do what you need. Capital projects, we are still moving forward on some of the capital projects that we're able to do. We have 6 apartments under various stages of remodel at the moment in all of the buildings. So at some point when the world opens back up and we can invite new residents to join us, we'll be ready for them. The other thing that will affect each and every one of you, we're adding a function to our SARA system. That's the emergency nurse call system, dependents and whatnot. We'll be adding a motion detector to each of your apartments. This motion detector just senses when you're up and moving around, and once a day it'll send a report to the nursing staff of any apartment that there has been no motion detected. So it's really just kind of an extra layer of security. For example, if you fell in the night and couldn't get to your pendant to call for help, there's just one more way that we're going to know that we need to come in and check on you. So as we get closer to actually installing the devices, I'll make sure that you get some better written information with more details, and we can answer any questions that you have about that. So looking forward to that. In transportation, of course, the K-Vork and Arturo and Donisha are all still here with us and available to help you get you to your medical appointments. At this point, we're not doing any other transportation, unfortunately, due to the pandemic. We are utilizing mainly the larger vehicles, the large buses, so that we can distance people while we're taking trips. So masks, of course, everybody needs to wear their mask while you're out with the driver, and of course the driver and any of the care staff that accompany you will wear theirs as well, and we'll follow the distancing recommendations. The drivers are also sanitizing the vehicles between each trip, so they're using the same EPA registered disinfectants, and we're taking just all of the measures that we possibly can to ensure that you have a safe and healthy environment. And then the last thing is the off-site shopping. So we do have staff that are going out and doing shopping for groceries and prescriptions and different things like that. You should be getting a blank order form every Friday delivered to your door. You'll complete that, hang it on the door. We just ask that you give us as much information as possible about the items that you want, brand names, sizes, flavors, whatever you can think of that'll help us find the right thing. That's very, very helpful. And then we added an area at the bottom for you to indicate whether or not you will accept substitutions. With the whole pandemic climate right now, what we find is that some of the stores have reduced inventory. Some items just aren't available. We went through that with the toilet paper for a while. So if you'll accept a substitution, we'll find something similar and bring that to you instead. If you will not accept one, please just indicate that, and then we'll let you know that we weren't able to get the thing that you needed. So if there are any other questions about the shopping and that kind of thing, we're just willing to do anything that it takes to make sure that you're not forced to be in a position that you have to go out to a crowded public place like the grocery store. So give us a call, let us know what you need. We're happy to help in any way that we can. I want to just wish you all health and happiness, and I hope that this pandemic is over very soon and that we can all be back together in person. But in the meantime, I guess you'll have to live with our amateur filmmaking efforts. So take care, and you are missed. We definitely miss seeing everyone. So be well.
It's Dave. I'm back. My presentation will be short since not a lot has changed since my last presentation on Channel 1960. Last Friday, I was on a call with the lead Los Angeles County public health physician. It was a call specifically for senior communities. He confirmed what most of us have already heard. Unfortunately, the situation as far as COVID-19 has become worse in Los Angeles County. One of the key metrics the public health department tracks is the positivity rate, which is the percentage of individuals tested who test positive. A higher positivity rate signifies a higher level of community transmission of the virus. The positivity rate in Los Angeles was 5% at the beginning of June, but as of last week, the positivity rate had increased to 9.5%. So basically, we have more people walking around with the virus, many of them not realizing it, who could then potentially share that virus with others. This is a time to increase our vigilance and be extra careful, since there are more infected individuals around us. So this would be a good time to shelter in place and allow us to bring services to you, which of course we are happy to do. We will continue to monitor the situation, but at this point in time, we don't plan on adding any further activities in the month of August. We'll just focus on the activities that we already have scheduled, which are all outdoors and involve masking, social distancing, and disinfecting before and after those events. Hopefully, as the situation improves, over time we can begin adding more outdoor activities since the risk of transmission is less outdoors. In the meantime, we will continue our aggressive testing of employees as well as residents, which has helped keep us stay safe by identifying a few symptomatic yet positive employees before they could unknowingly spread infection in our community. As far as resident testing, last week we had 88% of our residents in the residential care facility participate in testing. I want to thank all of you who participated again for the greater good of our community. I hope you will all continue participating. I want to give you an update on a few significant capital projects that we anticipate will help us take advantage of our outdoor spaces, especially important during this pandemic. First, the motorized louvered patio cover for the Belmonte patio, which will protect us from elements such as sun and rain. We are awaiting the final bids, and we hope to get in front of the city of Rancho Palos Verdes as soon as possible to begin the permitting process. If that project goes well, we will look at similar patio covers for the courtyard patio and the care center patio. We have also ordered our 12 microphone system for the Belmonte room, and we are hoping for installation within the next month. As a reminder, we believe these microphones will allow us to have committee meetings and other events at a safe distance, but will allow us to have improved communication by utilizing the gooseneck microphones. One operational improvement we are looking to accomplish within the next month is to have our main dining room phone line connected to an iPhone so that someone on the dining team is always available to answer during meal times. That way, if there's an issue with your meal, you can contact somebody right away rather than leaving a message and having to wait. That concludes my presentation. Our team, as always, is grateful for the opportunity to serve all of you, and we appreciate your feedback and suggestions. Please keep sharing your comments and ideas. Until next time, stay safe and be well. And now a few words from our Council President, Betty Daisy.
All right. I just thought that residents should know that there have been a few changes to the council. Mel Hausrat has resigned, and David Albert is going to take her place and has promised that he will be the treasurer. I also wanted to report to you the results of the collection we took for Target gift cards for the employees. We took in a little over $8,000, which is enough for a $50 gift card for each employee. And I think that's all I have to say.
All right.